What your blood pressure numbers actually mean. Your blood pressure is written as two numbers, and they capture two different moments of a single heartbeat. The top number, systolic, is the pressure in your arteries the instant your heart squeezes and pushes blood out. The bottom number, diastolic, is the pressure while your heart relaxes and refills between beats. Top is the push. Bottom is the rest. Both are measured in millimeters of mercury. That's the mmHg you'll see written down. Here's what the ranges mean using the current American Heart Association categories. Below 120/80 is normal. From 120 to 129 on top with a bottom still under 80 is called elevated. It isn't hypertension yet, but it's a signal worth paying attention to. 130 to 139 or 80 to 89 is stage 1 high blood pressure. And 140 or higher or 90 or higher is stage 2. And if your two numbers land in different rows, you don't average them, you take the higher one. So 125/85 isn't mostly fine. That bottom number alone puts it in stage 1. But here's the part nobody tells you. A single reading is not a diagnosis. Your blood pressure rises and falls all day long when you move, when you're stressed, after coffee, even while you're talking. That's normal. Doctors diagnose high blood pressure from the average of repeated, properly measured readings, taken on different days, not from one number on one nervous afternoon. It's also why the clinic isn't always the whole story. Some people's blood pressure rises the moment a cough comes out at the doctor's. It's so common it has a name: white coat blood pressure. Others read perfectly normal in the clinic but run high in ordinary life. That's the masked kind. Which is exactly why the newest guidance leans on readings taken outside the clinic at home or with a 24-hour monitor to confirm what's really going on. So if you're checking at home, a few small things make your numbers honest. No coffee, no cigarettes, no exercise in the half hour before. Empty your bladder, then just sit quietly for 5 minutes and stay silent while the reading is being taken. Back supported, feet flat on the floor, legs uncrossed, and your arm resting at about the height of your heart. Make sure the cuff is the right size for your arm. And don't trust a single number. Take 2 or 3 readings 1 minute apart and average the last 2. In 2025, these guidelines were updated for the first time since 2017. The line for high blood pressure stayed exactly where it was, 130/80. What changed is how doctors use the numbers. Your number is now read alongside your overall risk, your age, your kidneys, your cholesterol, your history, using a newer tool called Prevent. In plain terms, two people with the very same reading can get very different advice, and that's the point. Now, when should a number actually make you act? If you ever see a reading at or above 180/120, sit down, rest 5 minutes, and check again. If it's still that high, contact your doctor promptly. And if it comes with chest pain, a severe headache, breathlessness, confusion, weakness, or changes in your vision or speech, that's not a wait and see. That's an emergency. Seek medical care right away. For most people, though, the everyday story is far calmer. Blood pressure genuinely responds to the unglamorous stuff. A little less salt, more vegetables, and other potassium-rich foods, unless your doctor has told you otherwise. Regular movement, decent sleep. Going easier on alcohol. And if your doctor does suggest medication, that isn't a failure or a life sentence. It's just a quiet tool that prevents the things you don't want decades from now. One honest caveat. If you're pregnant, older, or you live with diabetes, kidney disease, or existing heart trouble, your targets and your plan are genuinely different, and that's a conversation for your own doctor, not a chart on the internet. So here's the real takeaway. Your blood pressure number is information, not a verdict. It tells you where you are today, and almost always you have room to move it. If you'd like the simple version to keep on your fridge, the categories, how to measure properly, and exactly when to call someone, comment the word honest below and we'll send you our 1-page blood pressure cheat sheet. This is Sushruti, worth knowing. The why behind your health, explained simply and checked honestly. We'll see you in the next one. This is general information to help you ask better questions, not medical advice. Your own doctor's guidance always comes first.